Good morning, everyone, and thank you for joining us. We will be starting promptly at 11:02 to give folks a chance to get on. Thank you. See, some folks are starting to pop in. We'll get started in about a minute. All righty then. Good morning, everyone. Thank you for joining us today. In this month's webinar spotlighting Blue Premier, the next level of value-based care, you'll see how the move from fee-for-service to value-based care is critical in transforming the healthcare industry to improve quality outcomes and truly to impact long-term medical cost trends. I'm Julie Cates, Manager of Group Market Engagement, and I will be your host for today. I am joined by our expert presenters, Tabitha Dixon and Cedric Palmore. Tabitha is the Principal Strategic Advisor of Value-Based Program Strategy, and she's been at Blue Cross now for 12 years. And Cedric is the manager of our Blue Premier program, and he just celebrated his anniversary yesterday, and he's been here for 17 years. So thank you guys and welcome, and we really appreciate you joining us here today.
Thank you for having us, Julie. We're happy to be here.
Yeah, thanks, Julie. Thank you. Excited to be here.
Great, thank you. All right, so before we get started, I do have a couple of housekeeping items. This webinar is being recorded and will be provided to everyone after the session. Feel free to use the Q&A feature to ask questions throughout the webinar. We have a team of experts behind the scenes here ready to answer your questions as they pop up, and we'll also leave some time at the end as well. Lastly, at the end of today's session, we will have a post-webinar survey that will automatically appear in your browser. Your feedback is really important to us. It helps us create more dynamic and engaging webinars in the future. Plus, by completing the survey, you will be entered into a drawing to win a $25 Amazon gift card. We've been doing them all year, so good luck, and please be sure to keep a lookout for that. All right, so I'm going to go ahead and jump into today's agenda. We'll start by setting the stage with the state of healthcare and value-based care across the system. Then we'll delve into the Blue Premier model specifically, finishing up with results we've seen to date and what's next on the horizon. And I'm going to turn it over to Tabitha, but before we get started, I am going to start with a poll question. So everybody get ready. I'm going to launch this here. Hopefully, can y'all see that?
We can.
All righty then. So when you think about healthcare costs for your business this year, what is the most concerning to you? Is it drug costs, inflation, increased demand for behavioral health care, COVID, whether it's direct or long-term impacts, or health policy mandates? And I see that we're getting a few of these coming up. Some of them are very predictable here. Be sure just to select one, and while you're doing that, I'm going to go ahead and turn that over to Tabitha.
Thank you, Julie, and thank you all again for being here. We are really happy to be here talking to you about value today. And looking at the poll, it was just as we could have all probably predicted cost related to drugs and inflation seem to be the most pressing. And I'm going to talk to you about why value-based care is one of the key ways we can work to control cost and improve quality of health care for you and your employees today and in the future. So we'll jump right in on the next slide into why managing cost and quality is so important. So if you look at this slide, you see that U.S. healthcare spending exceeded $4 trillion in 2020. So let's focus on the per person number starting in 1960. So you see $146 per person. So from 1960 to 1990, the annual average trend was 10.4%. Now, I'm a nurse, I'm not an actuary, but that number seems really high to me. So from 1990 to 2021, we see the per person number jump to almost $13,000. And I don't know about you all, but that 2050 number of 140K per person makes me want to go back to bed and pull the covers over my head, but we can't do that. I think we would all agree that we can't let that happen. And the good thing is that there are some things that we can do about it. But before we get into the interventions, let's continue to set the stage for why we need to do something about this. On this slide, we'll take a look at the impact of inflation on healthcare cost. And so for all of us, inflation has been a really hot topic recently and for valid reasons. So if you take a look at this table, the dark blue bars represent inflation and the light blue bars represent medical services. So as you can see, medical costs are much higher than inflation in 2020. This flipped in 2021 and 2022 compared to the last 20 years or so, and everyone is feeling the pressure. So what does this mean to you, really to all of us? A 13% inflation rate over the last 2 years puts a strain on all of us, on your employees, and especially when it's driven by really large growth in some essential, really things we need to live, like housing and transportation and food. And so eventually employees will demand increased wages to compensate. It's likely, and we've seen this, that hospitals and other healthcare providers will begin asking for higher unit cost increases, much larger than what we've seen in the past. So what can we do? What is really within our control? So one thing is value-based contracting, because that can help moderate the unit cost increase. And also our provider contracting. Contracts tend to be signed for multiple years at a time, which can really help protect us against those really acute spikes like we saw in years past, recent years. So how much do you expect your employer premiums to increase for 2023 from 2022? This is another alarming stat. One consultant went out on a limb and predicted a 6.5% increase from 2022 to 2023. And again, I'm not an actuary, but I borrowed some numbers and information from our actuarial team. Cedric and I work very close with lots of others on the internal team at Blue Cross, such as actuary and quality and many others. So since 2020, or really when COVID struck, actuaries are really, trying to predict the trend for the next few years. And it's really like predicting the weather in North Carolina. You don't know what it's going to be until you wake up. So on this slide, you can see that the impact of COVID, the return of deferred care as a result of COVID, the new normal, practice pattern changes, and more all play a role in this unpredictability. And so now let's talk about how we can manage the rising cost. And at Blue Cross of North Carolina, we are really betting on our programs to help in this area. And so, again, assuming that medical inflation in 2023 is 6.5%, as we mentioned earlier, at Blue Cross, we want to bend that curve from 6.5% to 2%. And there are several levers that we are applying to bend that curve. Things such as creating a cost of care team. We have a whole team of subject matter experts really dedicated to focusing on managing the cost of care. We have a care management team. This team is using AI to identify members with significant health conditions and identify them much earlier than we've been able to do in the past. Because we all know that prevention is key, and the earlier we get these individuals into care, the better the prognosis will be. We're looking at formulary and pharmacy management. We're looking at network value and contracting through Blue Premier, and Cedric's going to tell you more about that in a few minutes. We're looking at payment integrity, fraud, waste, and abuse. So let's talk about why value-based care reimbursement contracts and other programs associated with them are so critical for both the short and long term. But before we do that, I think that Julie may have a video to share with us.
I do. Thank you, Tabitha. Here we go.
Sounds good.
Okay, and I'm going to get it started soon. I'm sorry. I've got just one slide I did want to tee up. This is, you know, the information that you provided just really does set the stage for the importance of value-based programs, among other cost-saving programs, like you mentioned as well. And I am going to kind of tee up the next section by showing this video. So let's take a look.
There's a transformation happening in the business of healthcare, a fundamental shift that's increasing focus on health outcomes and lowering cost. It's the transition from fee-for-service to value-based care, and it's changing the way providers are paid and care is delivered for the better. In fee-for-service, doctors are paid for the quantity of services provided. Value-based payments are tied to quality of care. Value-based care is no longer just an attractive concept. It's a hard-working solution that's rooted in extensive health data and analytics. Because when doctors are armed with insights from robust claims and utilization data, they can identify ways to deliver better care, eliminate unnecessary treatments, and keep patients healthy. Across the country, Blue Cross and Blue Shield companies are using our strong local expertise and deep relationships to help providers change the way they deliver care. Providers are following evidence-based guidelines and ordering fewer unnecessary tests. They're helping patients remain adherent to their medications. They're shifting their focus from sick care to preventive care. And together with their patients, they're decreasing avoidable hospital visits. These improvements and other efficiencies are making a promising impact on long-term cost, increasing quality, lowering cost, and leading the transformation to value-based care. This is how Blue Cross and Blue Shield companies are helping employers deliver smarter, better healthcare to their employees.
Thank you, Julie. I love that video. And guys, as you saw in the video, one of the hallmark features of value-based care is that providers are paid based on quality and quality outcomes. So this really helps clinicians focus on improving the health of their patients rather than simply performing more procedures. So a primary care physician acts as the healthcare quarterback, considering a member's physical and mental health and leading the medical team that coordinates their holistic and comprehensive care. So by giving primary care physicians more data, including analytics on how their practices are doing against clinically accepted quality benchmarks, they can intervene in patient health issues earlier and work with a coordinated team to help patients adhere to their treatments. Because this just makes me think of drugs that are prescribed to members. And I heard one of our pharmacists say in a video or at a talk that he gave not too long ago that the most expensive drug is the one that's prescribed, filled, and never taken. So it's important that our primary care doctors are following up on that, making sure that that our patients are actually taking these medications and getting the benefits that they can get from that. So now I'm going to talk to you about how Blue Cross is tackling value-based care on a national level using a program called Total Care. Once I go through this, Cedric will talk to you about Blue Cross NC's value program called Blue Premier. We're really proud of that. But first, Let's talk about total care. So across the country, the Blues are heavily invested in value-based care. So we are, like I said, collaborating with doctors to improve patient outcomes by empowering them with tools and actionable data to help them deliver more targeted patient care. We are creating provider risk sharing arrangements and rewarding better care coordination. This helps providers to take on more accountability and even risk over time. And so identifying those providers who are improving the quality of care they deliver is important because we can share those best practices. We're measuring patient outcomes and tracking the appropriate utilization of services. So ultimately, all of this leads to members being more informed about their care and can also lead to higher satisfaction rates. So we have over 600,000 providers participating in total care in the Blue Cross value-based care arrangement. About half of those are primary care physicians and a little more than half are specialists. That is 3 times more than the number of providers in our closest competitors' programs. So nearly 70% of Blue Cross members have access to value-based programs, and almost 50% of healthcare spend, so 50% of total claims, are tied to value-based care. So on the next slide, you'll see the coverage area for total care. As you can see, it's available in 44 states in the DC area. We believe we have an obligation to do everything possible to hold down costs while also increasing the quality of healthcare for everyone. And that's really why for years we've been leading the industry and paying doctors and hospitals based on their ability to help your employees get healthy and stay healthy, and to help them better navigate healthcare when they need it. So how do total care physicians versus non-total care providers stack up? So when you consider how total care providers perform against non-total care, it translates to increased quality and better outcomes. In fact, we see more appropriate care, better control of chronic conditions, more preventive care, and less utilization of unnecessary services. So, for example, when you compare to non-total care providers, you can see that 3% are better utilizing imaging services, 4% better comprehensive diabetes care, and we see a focus more on cancer screening. And so now that we've talked about total care and what Blue Cross is doing on a national scale, I'm going to turn it over to Cedric, who's going to tell us all about Blue Premier. Thank you, Cedric.
Yeah, thanks, Tabitha, and good afternoon or good morning, everyone. I'm a little ahead of myself there. So as you've seen in the previous slides, value-based care has foundational elements that comprise a model. For the next few slides, I'm going to tell you about, like Tabitha said, what Blue Premier looks like for us here in Blue Cross of North Carolina. So let's go back a little bit to help us tackle the affordability and access and quality of outcomes aspect of our membership. We decided to create a program, and it's called Blue Premier. Debuted in 2019. And so basically what we were focusing on is shifting the cost of quality, accountability, and risk-bearing entities such as our providers or accountable care organizations. And so those consisted of health systems and our independent provider aggregators. And so basically setting out to change the way we pay for providers. So it's a reimbursement model. And so we want to reward providers based on quality outcomes and their ability to drive medical expense savings. Very different from fee-for-service or volume of services that most providers get paid for today. So Blue Premier launched in 2019. And a key element is that providers and ACOs are paid a shared savings or other reimbursements based on their overall performance against total cost of care measures and their quality benchmarks. Happy to report that Blue Premier today has all of the major healthcare systems in North Carolina and over 800 plus independent primary care practices within the program. So that's an overview, but I think it's always good to kind of see what is in the model. So on the next slide, I've got a visual for you to kind of show you how Blue Premier is put together. And I think that's important for all stakeholders to understand that we just don't do this haphazardly. It's very deliberate. And so this further illustrates our collaboration with our provider partners. So as you can see on the far left, you see provider roster, and that's supplied to us by our ACO partners. They tell us which doctors they want to be in the program, and that could be location specific, but we are talking about primary care. So any primary care provider and OBGYN or other specialties that we recognize, they can send us those doctors. We marry that up against our internal member attribution methodology, some criteria that we use to say, hey, this person or this member has primary care claims or services. And so we marry those two together to arrive at ACO's attribution. And so this attribution is set for the current performance year. And so providers know who they are responsible for. And so that's their attributed population. These are the people that they know they have to take care of from a quality perspective, as well as a utilization or medical savings perspective. So once that attributed population is determined, we set performance targets, especially for financial performance. We establish a PMPM target for each one of our segments, and that can be ACA, ASO, and other commercial segments that we have here at Blue Cross. Each ACO has its own individual PMPM target as well as each segment. We have established quality performance measures that are consistent across all of the program. All ACOs are adhering to the same quality measures. And as you can see on the slide there, that's a mixture of professional quality and hospital quality. So using HEDIS as the foundational aspect of our quality measures, that provides for a consistent collaborative effort that everyone should be familiar with. The other aspect of the program is that we are really, really big on risk coding efforts, because we know that's very important to code a member's service correctly, because that drives revenue, and thus making sure our members are taken care of as well as your employees helps drive down savings, because everyone's participating in the program effectively. From all of that put together, at the end of the performance year, we evaluate how an ACO provider has performed. And thus, if you've performed well, you will reap the benefits of your quality bonus and a shared savings payment. But seeing that this is a risk-bearing program, if you didn't fare well in the performance year, there's a possibility that you could have to pay Blue Cross back some shared savings dollars because of the lack of effort or inability to achieve the savings. So I think this visual tells a great story about how Blue Premier is put together, and we have a ton of people that help us do that. So the next slide is really going to tell us about those folks that really are on the tip of the spear to make the program run. And that's our accountable care organizations, or ACOs. And just to familiarize everyone on the call, ACOs are basically a group of providers that could be health systems, doctors, health professionals that have come together voluntarily to create an organization. They are going to coordinate technology, care paths to achieve those goals and targets that we've set forth in the program. As you can see, each ACO is responsible for their own attributed membership under their value-based contract, and then they provide that high quality care under a shared savings arrangement. So it is twofold: quality and shared savings, and you'll continue to hear that throughout the presentation today. And so one key element is that it's not specific to a product, so product agnostic. And that's very, very important. That means all Blue Cross North Carolina members can be seen by a Blue Premier provider. And so plan coverage has no impact whatsoever on the program. So this is a program and not a product. And I think it's very important to have that distinction, because even internally, sometimes even our internal employees think it's a product that we sell. We sell value, basically. And really, we lean on our ACO provider collaborators to help us achieve success. So in a nutshell, outcomes reimbursement model: the better you do, the more you get paid. And then it further illustrates our commitment to primary care, and seeing that the primary care physician is the quarterback of your care. And then it's also following up with ensuring that our members get the right care at the right place at the right time. And really and truly, from a medical expense perspective, it's trying to avoid as much waste in the system by not just, fee for services and those valued services that we all think all our members have, not to have that taken advantage of under the shared savings agreement. So not only from a primary care perspective are we focused on value, we're also playing ball in the specialty space as well. Specialty care, high cost services, high cost care. As you can see on the slide here, we're currently focused on advanced kidney disease. We realize that is a high claim driver. So one of the things that we wanted to do from a strategic standpoint is to create a program that allows our members that meet that criteria to have more intensive care or collaborative services provided to them so we could either improve their overall health or maintain where they are from a CKD, chronic kidney disease, or ESRD stage. That program has been very successful to date, and it's only been in the market since 2021. So as you can see, finding the right partner to deliver value-based care in this aspect will help contain costs, drive down costs, and ensure that our members are getting the best possible care when they have these types of chronic conditions. So based on these results and what we see in our current data, we're looking forward to what's coming next from a specialty aspect. We're looking at chronic musculoskeletal care management or a specialty model, which we're going to launch sometime in 2024. High claims, as you know, knees, elbows, and hips, they cost a lot. So we want to make sure that the right people are getting those services, or we're trying our best to prevent them from having to get that surgical need that many of our members have to go through because we haven't done a great job at preventing that. So that's what that model is going to be intended to do. And the same to be said for cardiology and oncology. We're currently developing what those models might look like in a value-based arrangement. So continuing to figure out what can value-based care do to drive better outcomes from a quality perspective, as well as drive down medical savings for our members and you as an employer. So you've got specialty care and primary care, and we talked about ACOs a little bit. So let's see where our Blue Premier providers are. State of North Carolina, and this is as of 2023. As you can see, we've done an awesome job at recruiting our health systems and independents to be part of the Blue Premier program. I can say we're currently not recruiting because we've got all the major health systems in the program today. And like I said before, with 800 plus independent providers within the system. But as you can see, we've covered the state from the west to the east to the Piedmont to the Triangle. We've done a lot of work with our ACO collaborations to make sure we've got coverage for all of our members in the state of North Carolina. Very proud of that overall effort that we've put forth. So as you heard Tabitha talk about from a value-based care perspective, reporting is a vital aspect of the program. And talk to you a little bit about Blue Premier reporting, specifically from a group perspective. We provide reports to our ACO partners so they can go down the pathway of making sure they know which quality care gaps they need to close, how they're doing in relation to their shared savings targets. But our self-insured group partners also need reports to see how well their employees are being taken care of. So with Blue Premier, we provide a bundle of reports either throughout the year or at the end of the year, all based on ACO's attributed population. So what that means is that you as an employer, your employee would be included in some of that attributed population that ACO is being taken care of. We share savings reports on a quarterly basis that talks about shared savings by the group's participating ACOs. So if you think about all of your employees wouldn't be in all of those ACOs. So it's just going to reflect where your employees show up and which ACO provider that they're actually getting care from. You've got access to these performance reports, like I said, annually, quarterly, and they're available on demand at any time that they're available. So reporting a very crucial key to this program, and one that we feel very, very critical in nature about, because as a key partner, employer groups need to know how well this program is performing, because it indicates how well your employees are being taken care of under this program, and we feel really good about that. So that's the program model in a nutshell. A lot of moving parts. A lot of work has been done over the last 4 years of performance years since 2019. So I would be remiss not to celebrate some of that success in a short period of time. So let's look at those numbers to see what we've achieved thus far. Yeah, that's not a typo. That's $650 million of gross healthcare cost savings to date. As a performance year 2022, $650 million. What you see on the left, though, is a consistent cost savings that we have achieved with collaboration with our ACO partners. Starting in year one of 2019, we achieved $153 million. That's nothing to sneeze at, seeing that we're just coming out of the gate with this program in 2019 with a handful of ACOs. I'm going to point out 2021, $130 million. That's very, very critical too, and really, really something for us to be excited about, because as we all know, a lot of healthcare systems were impacted by COVID, but we were still able to achieve $130 million in savings because a lot of folks stopped going to the doctor due to different regulations that were put in place from a prevention standpoint of COVID. So that's overall financial program success today. Let's drill down to see what participation looks like within the program. So I don't want to toot the horn. I don't have one of those buttons that I can push right now, but it's something to be said going left to right. When you think about, we've got 100% of the largest North Carolina health systems in Blue Premier's 2022. That's really remarkable, because they all have different needs, different goals, but they all coalesced around this program because they saw the need on they needing something to help them with quality outcomes and a different model for them to get reimbursement dollars. Something to be said for a health system saying, okay, I'll take a decreased fee-for-service schedule in order to have the opportunity to make more from a shared savings perspective. We got them all in about 12. It's 12 major systems here in the state of North Carolina. Blue Premier has a far reach, wide footprint. 68% of eligible medical expense is aligned with the Blue Premier contract as of 2022. Think about that. That's over 50%. It's almost 70% of our medical expense is aligned to a Blue Premier provider. So very, very important program, not just for us that get to manage it every day, but through the Blue Cross's enterprise, because it's vital from a accessibility, affordability, and medical expense savings effort. 56% of independent primary care practices are part of Blue Premier. We help manage those independent practices by partnering with what we call aggregators. These are companies that specialize in value-based care management. So they contract with those independent primary care practices to teach them and help them in the value-based care space. When you think about 56% of the total independent care population, that's those independent doctors that don't have to partner with a large health system and can remain independent and deliver the type of care, quality of care that we so desire for all of our members. And then, as a key goal that we have is having 55% of our members eligible members, meaning that they, have primary care claims or services that we can track. they are all assigned to a Blue Premier provider. So that's over half of the segments that are part of Blue Premier that are seeing a Blue Premier provider. And last but not least, 1.4 million eligible members are aligned to a Blue Premier provider. That's nothing to sneeze at. I mean, that's a lot of folks. If you think about it, that in 4 years, we've been able to amass 1.4 million and maintaining that attributed life with our Blue Premier provider. So awesome results for not just the program, but Blue Cross North Carolina as a whole, because it just shows that we're committed to value-based care and the quality outcomes so desperately needed for our members. So when we think about quality, what does that look like? Because I mentioned, we have performance measures that we're holding our ACOs accountable for. So when you think about these programs, and we've seen a steadily increase in improvement year over year since 2019, looking at health outcomes, preventive health services, risk adjustment targets, and clinical data exchange participation, because Tabitha mentioned data is a critical element of this program. And so we need that collaboration with our ACOs year over year, month over month, as we, continue down this path. But looking at some of 2022's results, nothing to sneeze at really when you think about, if you look at the conditions that we're actually trying to thwart or bend the curve on, when you think about hypertension or high blood pressure, just having these members under the care of a primary care physician, which it just means that they're going to get constant care, that condition's going to get managed. We've all been talking about diabetes here lately. 13% increase in diabetic members with controlled blood sugar levels. Colorectal screenings, heightened awareness there. We've seen steady results, slight increases, but consistent in this particular test and management of this particular service. And then breast cancer screenings, so very important. Our providers continue to deliver on this measure and knock it out the park for us. So very excited for those results from a quality perspective. And we've seen that trend improve year over year since the program has been an exception. So maybe providers would have done this without Blue Premier, but having solid performance measures tied to incentives that help balance out, utilization and savings is paying off, not just for Blue Cross, but for our members and you as employers, because those are your employees. So, we talk about quality and we talked about the program mechanics and models, but what does that look like in a real life situation, or how we actually administer the program? And collaboration is one of those key aspects. And so I wanted to take you down an example that just happened not too long ago, but it's an ongoing example of how this program works. Like I said, diabetes management is really big, whether it's in value-based care or just overall. It's a chronic condition. High claims are associated with it. So you want to make sure you've got a program in place that can manage that condition. Here recently, we had a ACO, we call it ACO Day of Exchange. And what that was like our internal provider engagement team, our quality team, and a couple of our ACOs from the community came together to talk about this particular condition and share best practices on what they're doing, what can we do to help improve the overall outcomes as it relates to diabetes. Very successful meeting. Those will be ongoing. But as you think about it, our clinical pharmacy team was at the table as well, because one of the high cost drivers of diabetes is medications. So our clinical pharmacy team, and we have a dedicated cohort of pharmacists that just work with our Blue Premier program and those Blue Premier providers. They're providing or giving reports to our provider population that show them like where they are in relation to a particular disease state. Was the pharmacy diabetes targets report. That's really specific. And, by giving that to a provider, it allows that provider to focus in and hone in on the medications, the adherence, trying to move the curve a little bit to a positive position as it relates to medications in relation to diabetes medication adherence. So that's Blue Premier in action. And that's just from a pharmacy standpoint. We have several different work streams within Blue Cross of North Carolina to help move that along from an outcomes perspective, as well as also trying to keep total cost of care in line with that ACO's goals and targets they have set for that performance year. So a combination of member focus, company focus. So a lot has been covered. And this program is massive, if it's indicated by the numbers I just kind of went through. And this slide says it all. It does take a village for us to manage and execute this program. It falls back on Blue Cross North Carolina's mantra, one team. And what you're seeing is a small sliver of the key areas that make this program run. To know our team, the Healthcare Value Program Strategy and Operations team, is the last bullet. And I put it's there because we create the strategy, but we rely on everybody above and those above bullets to help execute, implement, and run this program from a day-to-day perspective. So, like I said, shout out to those folks that partner with us internally to make sure this program is successful as it has been and will continue to be over the next few years, and hopefully longer than that. But in this time, we have to look at things in a more micro look and say, okay, over the next 2 to 3 years, what does that look like? But we're well on our way to be a 4-year-old company. So, I mean, not company, but a program. Sorry about that. With that, with 4 years and having gathered a lot of data, what does the program look like going forward? Just want to talk about that a little bit, and that we are not content on the success that we have in the model that we have today. We have reviewed the data that we have collected. We have talked to our ACO providers. We have talked to internal stakeholders. And what we've realized is that though we have had success, the program is tilted a little more towards the quality aspect of the program. So the future of Blue Premier, it's going to rebalance that focus of the initial intent to balance medical expense savings along with quality outcomes. And that's going to be a real big focus for us. And it's important because, as Tabitha talked about medical inflation, and we talk about affordability all the time, it's going to be key that we really, really focus our ACO providers on the medical expense savings aspect of the program. We're also going to be introducing health equity into our quality program for the first time. We feel that, making sure that we're looking at disparities and helping underserved members that are a part of this program is a key element in moving forward with this overall effort in value-based care. And so we look forward to that. And so, we think about, as we move to the next aspect of Blue Premier, we're, those elements that you see on the screen are critical for us to kind of hone in on. And I'll go through them, one by one, just so you get a clear understanding of what we're talking about here. Refine our contract model. Well, a value-based agreement is very specific, but what we really wanted to hone in on is that our initial agreement was 5 years, and there were some provisions in there on when you could go to downside risk. Well, one of the things we thought we'd change, we shortened the lifespan of the agreement. So now going forward, our agreement will be 3 years, but when you sign or renew, you'll immediately be in downside risk if you're eligible or for downside risk. So that's one big change in the model or for the contract. It's like shorter term, putting you more at risk. And we've tightened up some of the shared savings elements as well as it relates to the overall model. So that's going to be really, really, really important, and it drives home that message of that rebalancing. our improving our analytics capabilities. Learned a lot in the first 4 years of like, here's the data our ACOs need, here's the data that we need in order to make sure we're providing the necessary information for an ACO to close care gaps. So we're going to expand our capabilities. We're going to partner with a new vendor to allow us to give that robust reporting that we so critically need. And a lot of this information, as it relates to reporting capabilities, came directly from our ACO partners. We're listening. We're trying to understand what it's going to take to make them most successful within this program. And then, like I touched on in the specialty slide, we can expand our specialty based models. That's just another avenue of tackling high cost in chronic conditions. Want to get them better managed so we can see better outcomes and decreased medical expense savings. So that's the future of Blue Premier. I can tell you we're really, really assertive about that because we plan on having, that's our plan, to have all of our current ACOs converted to this next iteration of Blue Premier by the end of 2025. I hope this information has provided you some more insights into the Blue Premier value-based program. Thank you for listening, and back to you, Julie.
Thank you so much, Cedric. I really appreciate it. That is just such a lot of great information. The part I liked the best was the collaboration with the ACOs that you had the day of exchange, I believe, and it really does show that there's more than this, than just a contract that's driving this model and the success that we're having. It's the people, and it's a lot of people who are involved, not only on the provider side, but on our side. And I do have to tell you a quick story. I did go visit my doctor in Raleigh. I live 3 hours away, and I love her to death. She's my PCP, and I went to her for a follow-up visit. And the first thing she said to me, and the last thing she said to me, is, "Julie, you're due for your colonoscopy." And I'm like, yeah, it's been 10 years. So it's working because they are making those special notes to tell the members that they have got to get the stuff done. So I know that's all part of Blue Premier. And of course, as I'm walking away, I'm like, check, there you go. And I'm one of them that's guilty of almost having a gap in my care. So at any rate, I really appreciate all that great information. And Tabitha, thank you also. I did want to see, I don't think we have any questions from the audience to this point, but if we have any now, if you want to come off mute, or if you just want to put something in the Q&A box, we're happy to take some of those. I don't know if Tabitha or Cedric, if there's anything that you want to just call out at this point as well. We can certainly do that. I'm not showing any open questions. We do have, we're just about out of time anyway, so I'll just go ahead, and I do want to make mention of a few things that we have available, resources regarding Blue Premier that are on our employer services portal. We do have a brochure and an FAQ document that have been recently updated for 2024. An attribution infographic, and finding a Blue Premier doctor flyer for your employees to use if they have questions about how to find one. I've also put links, as you'll see here, to a recent press release and a brain shark video presentation. And so when I send out this presentation and the recording after the webinar, you will have those links available to you. Okay, I think actually it looks like we have a question. They're asking if it's available after the webinar. Yes, Lisa, thank you. All right, so I do want to thank everybody for joining us today. If you joined late, again, it's been the webinar has been recorded, and we'll provide a follow-up email. Don't forget, when we close the browser, you will automatically receive the webinar survey that will pop up with a chance to win a $25 Amazon gift card. Our next webinar will be in December, where we'll discuss our member engagement efforts. This will be really, truly interesting, as a bunch of our the majority of our groups are going to have their effective date start in January. So that's when a lot of these campaigns kick off. So be sure to register for that one. I will put the link in the chat. And with that, Tabitha and Cedric, thank you again. I hope everyone has a great rest of their day, and we look forward to seeing you in December. Thank you, everyone.
Thanks,
Thank
Julie.
you.
Thanks, everyone.
Take care.
Take care now.